Okay, so here we are again. We are moving through the topics pretty quickly, of course. So for this class, we're going to talk about federalism, which basically deals with the separation of power between federal, state, and local authority. It's a complicated relationship, as you might expect, especially when it comes to defining the lines and the boundaries between, federal and state authority. So we'll examine that. We'll examine some of the arguments for it made in the Federalist Papers, and then we'll examine some contemporary issues that pertain to this sort of separation of power between federal and state government. Now, one thing that it leads to, of course, is because since state governments do have significant autonomy in this kind of system, it leads to various differences and discrepancies between state governments as well. States are not, governed, in other words, in a very uniform fashion, which of course some people like because it promotes a more sort of diverse approach to government. But it can, in many instances, lead to certain inequalities in various outcomes developing between states as well. And we'll examine some of them again in this class today. So basically, like I said, the basic idea of federalism is as a division of power between states and the federal government. Again, in theory, federalism is supposed to promote diversity and flexibility. In Federalist 39, for example, one of the readings, Madison speaks of what he calls a compound republic. In Federalist 45, he addresses concerns that the federal government will become too powerful. Federalism, or again, giving some autonomy to state governments is meant to address that, meant to prevent the federal government from sort of overreaching on its authorities, on its authority. Okay, so in Federalist 39, Madison declares, of course, that a Republican government, a government based on representation, is essential for the United States. People choose representatives to make decisions for them. Madison says the system is essential because it reflects the revolution's ideas of self-government. It leads to people being able to govern themselves. It protects freedom of giving power to the people, not a king or a single ruler. Works best when everyone can participate, making it, basically a democratic republic. Laws are fair and leaders are checked by the other branches of government. Power comes from the people, either directly or indirectly. Offices are subject to, limited terms or to the so-called good behavior of the person holding the office. And of course, they must represent the majority of people, not a privileged class. This is what Madison argues. So Madison argues that there's a Republican nature to the Constitution. The House is directly elected by the people. So he argues this is the Republican principle. The Senate and president will be indirectly elected, which means they will basically be chosen by the states, not directly by the people themselves. Judges, of course, are appointed and serve during good behavior. So he focuses on both what he calls the federal and national dimensions of the government. Federal is established by the states. National basically pertains, more directly to the people itself. So once again, the House of Representatives, which are elected by the people directly, falls under the idea of the national rubric, whereas the Senate, because they are chosen by the state governments, not by the people directly, pertains more to the federal aspects of this. The president, he says, is mixed. People vote, but you also have the electoral college, which really plays the decisive role in choosing who the president is. The people's vote only counts in an indirect way. The powers of the government pertain to people themselves. People are, of course, bound by the laws of the government. But there's a strong federal dimension to this as well, of course, in that the powers of the federal government are limited and that states retain, significant autonomy as well. And then there's, again, other areas where the powers are mix, for example, in the process of making amendments. And in Federalist 45, he talks about the concerns that the federal government is going to sort of overreach itself. He finds these claims to be exaggerated. We don't often talk about the anti-federalists, basically the people who were opposed to the formation of the Constitution, or at least were very cautious and skeptical of the establishment of the Constitution and the powers given to it. However, they do have a very important legacy. I mean, you can really attribute the Bill of Rights to concessions basically asked for by the anti-federalists, who wanted to have more sort of explicit guarantees limiting the power of the federal government. And of course, we're able to some extent retain some degree of autonomy for state governments as well. So Madison argues that the purpose of a powerful federal government is to provide security against foreign threats, prevent wars between the states, of course, which it eventually failed to do in the Civil War. Guards against factions and standing armies. The goal, he says, is to promote peace, liberty, and safety, not power. Not power for power's sake, or the power of a ruling clique. The public good versus state sovereignty. Public happiness, he says, is the supreme objective. State sovereignty is secondary. So he's saying that having states be fully independent, or have sort of like a maximum extent of independence is not a goal in and of itself, right? The goal is to promote the public happiness, as he calls it, kind of a ambiguous concept. But if states retaining some degree of autonomy can contribute to that, then it's good. But just giving the states full independence, if it doesn't actually lead to the public happiness, or a greater public happiness, is not necessarily a goal in and of itself. So he's saying that whatever can best guarantee the public happiness should be the goal. And of course, he argues that the kind of federal system with a stronger federal government will best guarantee that. State governments, he says, are not endangered. They will still retain a strong degree of independence from the federal government. That is pretty much true. I mean, even to this very day, the power of the federal government has clearly grown, obviously, but states still do retain a pretty strong degree of independence. The federal government itself, depends on the states. Again, the members of the Senate are chosen by the state governments. Of course, at this time, they were directly elected or by the state governments themselves. People had no say at this point in who chose the Senate. The Electoral College is structured in a way that really comes down to, as I've already talked about when we were discussing the Constitution, that the states are the ones that essentially choose the president, not the people. Even under today's system, where the people's vote influences the electoral votes of each state, it still is a drastically different system than just having a straight, national popular vote. Again, federal power would mostly be limited to external threats. Internal matters would still largely be left to the states, so he claims. And again, which is still, I would say, largely true to this day, although with the caveat, of course, that the power of the federal government has grown, of course, significantly since Madison's day. Taxation powers would fall both to federal and state authorities. Okay, so now we can get more into the sort of division of power between federal and state government. And of course, local government as well. So here are two comparisons you can make here. In the past, people would say that federalism was more like a layer cake, and that there's sort of like clearly more of a clearly defined separation between federal, state, and local authority. However, as the government has grown, as the society has grown and become more complex, there's increasing sort of intermingling and meshing of different levels of authority. So now people would say that today's federalism more represents this kind of marble cake here, and in which there's not as much of a clear cut separation between the three different levels of government. And of course, we should also mention that state and local authorities are uh, basically set up on under the same system of government, where you have separation of powers, a legislative branch, executive branch, and judicial branch as well. That makes the government fairly complicated, right? In a sense, you could say there's sort of like nine different levels of government that you can sort of interact with at any given point in time. And of course, that doesn't even include things like county governments and other levels that exist as well. So now you get somewhat of a diagram of the separation of powers, where federal government power lies, where state government power lies, and where they kind of overlap. I'm not going to read everything. I mean, you can see it here. But again, the basic idea is that the federal government will, mainly deal with foreign affairs. It does, of course, have the power to coin money. It's a very obviously important power. The government basically sets the money supply. The federal government, I mean. It has the power to declare war. States can't declare war on another country. Only the federal government can. It has the power to amend the U.S. Constitution through the Congress, but of course the states have the power to fully ratify these amendments as well. State government powers, again, regulate interstate commerce. So the federal government can regulate commerce between states. States can regulate commerce that happens within their state boundaries. Establish and maintain schools, still a very important power to this very day. Like I said, also are necessary to ratify amendments to the Constitution. So then you have areas where their powers overlap. Taxes, there are both federal and state taxes. Both can borrow money from banks and from financial institutions. Both have their own court systems, of course. Both have their own legal systems, and so on and so forth. Again, you can pretty much read the rest of it here. So now let's get into some of the contemporary issues. I think this is where things maybe get a little more interesting, where we can talk about some of the contemporary issues related to federalism. Particularly, there are two things I want to focus on. One, the sort of boundaries between federal and state authority, particularly as it pertains to the deployment of force, the use of force, the exercise of power, which we'll see, as it's become, especially an important issue now. And we'll also then basically examine how the federal system leads to certain, or at least contributes to certain disparities in outcomes between states as well, in terms of health and education, for example. So here's a list of some issues that pertain to this. We don't have time to go through all of them, but healthcare policy, because states do have some autonomy here, you have various differences in how the states administer healthcare in their states and how they comply with other federal laws as well. Some states, as it says, have resisted implementing the Affordable Care Act and Medicaid expansion. Marijuana legalization of other drugs as well, varies from state to state. And then, of course, the federal government has its own laws regarding this. Immigration, sanctuary cities, something we'll spend a little more time talking about. Environmental issues, different environmental regulations state by state, different gun control laws state by states, as I think most people know. Some states have relatively strict gun control laws. Some states don't. You can basically buy guns, almost everywhere. Voting rights, education, even how states responded to the pandemic. And of course, this is not a complete list. Also, this is only a partial list, and of this list, I only have time to really go through a handful of these issues. But it speaks to how different states can be from each other. That they, because they're allowed to enact different laws, and because the sort of policy mechanisms and how policies are implemented, vary so much. You can often have various different outcomes and differences between states, regarding these issues, and many more. So let's talk about something that's just become very topical now. It's very complicated legality of these things, and how we understand the sort of different interactions between federal and state authority here. But I think one thing, of course, that's very relevant now is the issue of the federal government deploying troops, federal agents, the National Guard, national law, federal law enforcement authorities to different cities in the United States. Um, so we'll run through a few of them. So, for example, Los Angeles in June 2025, the Trump administration deployed federalized National Guard troops to Los Angeles in June 2025, citing crime and immigration enforcement issues. So every state has a National Guard. That was actually one of the things listed in that diagram there. And normally the National Guard is under the control of the state government. However, under certain circumstances, the federal government can take control of the National Guard away from the state and direct the troops under federal authority. I use the term federal troops. I know it's somewhat of a loose term. It's complicated by the fact that, yes, I mean, for many people, the differences between federal law enforcement like ICE, the use of National Guard, even active duty military can be very hard to define. And I think it's become increasingly hard to tell the difference in many ways, mainly because of the militarization of law enforcement agencies within the United States. In other words, there's supposed to be a separation between sort of using, military, including the National Guard, from law enforcement. However, many people would probably fail to see a difference between, highly militarized law enforcement agencies from basically use of military force. In other words, the distinction between these things are becoming, increasingly blurred. So to some extent, it might even be sort of a moot point. If the federal government has the ability to deploy law enforcement agencies, it may still feel and be experienced as a kind of military presence, even if technically speaking and legally speaking, the federal government is not actually using actual either active duty military or federalized National Guard troops. But I'll try to run through some of the circumstances here and try to delineate the differences between these. So California officials challenged the deployment in courts. This is something being done against the will of the Californian government. A federal judge ruled that the deployment and use of troops for law enforcement type functions violated the Posse Comitatus Act. I'll talk about that more in a moment. But basically what that law says is that it basically puts strict limits on the use of soldiers, again, including National Guard, to perform law enforcement type functions, basically arresting people and things like that. By late 2025, early 2026, these federal guard forces were ordered to return to state control or demobilized. Marines or active duty troops were discussed in some internal memos and legal filings early on, but the key legal rulings emphasized Posse Comitatus restrictions. The federal troops cannot perform arrest or law enforcement absent Insurrection Act invocation. So we'll talk about both the Posse Comitatus Act and the Insurrection Act in a moment, but just to sort of, run through some of the episodes here where this has become a thing. And again, it speaks to this kind of, where does the boundary rest between sort of federal and state authority? In this case, the federal government is, attempting to exert its presence in a state which clearly does not want it to be. Sometimes the state governments, ask for help from the federal government and even ask the federal government to take control of the National Guard and to direct the National Guard itself. But this is clearly not one of those circumstances. Anyway, the bottom line is that the troops were removed after court orders, legal constraints affirmed. In Washington, D.C., a crime emergency executive order was issued by the Trump administration in August of 2025 for Washington, D.C. An area of the country, of course, has a special legal structure unique to the District of Columbia because it does not have a state governor. So it's basically more or less under the direct, there is a mayor of Washington, but basically the DC National Guard pretty much always operates under direct control of the federal government. And of course, other federal agencies, the FBI, the U.S. Marshals, can operate without state consent as well, or in this case, the consent of the city government, the municipal government. Local officials sued, arguing that the deployment was unlawful, undermined the district's authority. Some courts have ordered constraints or review of the deployment. However, as of now, Guard troops and federal law enforcement remain in place in Washington. Memphis, Tennessee, in September, the administration announced the deployment of National Guard troops and federal law enforcement to Memphis to combat crime, often presented as part of a broader crime emergency strategy. Reports from observers and local coverage indicate these Guard troops were positioned alongside local police and not used independently for arrests, consistent with posse comitatus constraints when not invoking the Insurrection Act. Tennessee's Republican governor publicly supported the deployment, which distinguishes Memphis from some other cities. So in this case, the state government is asking for this help, or at least is supporting it. And as of now, again, there is active deployment of federalized National Guard troops. So National Guard maintained by the state government, but under the control of the federal government at this point. And again, we'll talk more about the Insurrection Act in a moment. In Chicago, a federal plan to deploy 300 federalized Illinois National Guard troops and additional Texas Guard troops was announced under U.S. law, but faced immediate legal challenges. The Supreme Court declined to allow a broader deployment, and lower courts blocked or limited the federal guard's presence without lawful authority. As of late 2025, many of these troops are being withdrawn or blocked from active duty, and the city and state officials continue to challenge the legality of the orders. The deployment is legally constrained and has largely stalled. So you can see in some cases too, states have been able to fight back and have been able in some cases to block or at least end the deployment of these federal troops. So states do have, even now, like I said, some degree of independence from the federal government. They can't maybe stop them from initially deploying them, or at least issuing an order for that, but they can actually, after the fact, block these things from happening, or at least causing them to end. Trump has also announced the deployment of 200 Guard troops to Portland, claiming domestic terrorism threats. In October and November 2025, federal courts repeatedly blocked those deployments or federal forces from operating in Portland, finding that conditions did not justify federalization and the state objectives were valid. As of early 2026, no lawful enforcement or operational deployment has taken place. Those orders have been blocked and troops withdrawn. Other cities, New Orleans, National Guard troops were deployed at the request of the Louisiana governor. So again, at the request of the governor there. And local officials have been publicly debating the effect. Violent crime statistics show substantial declines in 2025, though controversies over federal force roles continue. San Francisco and other cities, federal agents. So here we have to distinguish between federal law enforcement from, basically military, including National Guard troops, have been seen. But so far, the full deployment of the National Guard has not taken place. Trump has talked about it, but apparently had backed off at the last moment. Now, again, I would point out that this does not mean the federal law enforcement agencies, including ICE, are not active in these cities. What it basically only says is that the ability of the federal government to deploy the National Guard, which again sort of functions as sort of like an adjunct military unit, right? I mean, oftentimes are called up as military reserves, have in some cases been blocked, and the use of the active duty military, particularly in a way that which they could perform the function of a police force, has also not happened yet. Although Trump has almost, constantly has threatened to do this by invoking what is called the Insurrection Act. So let me talk a little bit about sort of the legal basis governing a lot of these things. And again, as you can see, the courts play a significant role in this as well. So the Posse Comitatus Act was passed in 1878 after the end of Reconstruction. It limits the use of U.S. military to enforce domestic laws. It was a direct reaction to the widespread use of federal troops in the South during Reconstruction to enforce civil rights and oversee elections, something white Southerners bitterly opposed. It symbolized the federal government's retreat from Reconstruction and protecting Black civil rights. It reinforced the principle that the military should not act like a domestic police force in American cities and states. So there's an interesting legacy to this law. I mean, many people would probably applaud the idea that it limits the power of the government to basically deploy the military within the United States. However, the historical context of it was basically the law was passed as a way to essentially end Reconstruction after the Civil War, which did depend upon the power of the U.S. Military to, again, protect the civil rights of former slaves, to oversee elections. Something, of course, as it says, was bitterly, fought by the white Southerners. So, was limiting. Did you necessarily want to take the army out of the South during this point in time? Some people, might have agreed with the use of military force there. That's the point I'm trying to get at. So even though most people probably applaud the law now, it's interesting, the context in which this law was originally passed. So let me try to separate a little bit. Like I said, we're talking about at least three different things. We're talking about active duty military. We're talking about the National Guard. We're talking about law enforcement. And again, understanding the differences between the three is increasingly becoming blurred. Right? Even federal law enforcement agencies are only active. To many people, it may perceive it as if it is a kind of military occupation. So active duty military includes the Army, Navy, Air Force, Marines, and Coast Guard. They are generally prohibited from civilian law enforcement due to the Posse Comitatus Act. They cannot make arrests, conduct searches, or perform policing functions unless explicitly authorized by statute, like the Insurrection Act, which, again, I will discuss in a moment, or in narrow circumstances, for example, protecting federal property. Exception, the Insurrection Act allows the president to deploy active duty military for law enforcement under conditions such as insurrection, domestic violence, preventing enforcement of federal law, or civil disorder, but this is rarely invoked. And in fact, I'll cover a few examples of this. I mean, it's almost never invoked. Yet Trump is, repeatedly talking about doing something like this. And it's certainly within the realm of possibility that he might do something like that. So in other words, what this would do by invoking the Insurrection Act, this would actually allow Trump to basically call in active duty military. And not just to support or to provide some kind of support for other agencies, but to directly perform, the functions of policing, making arrests, searching, things like that. National Guard, commanded by the state governor, they can perform law enforcement duties, including arrests, searches, traffic control, because Posse Comitatus doesn't apply to them when under state authority. That's a key distinction to keep in mind here. When the National Guard is under the control of the state, it does not have the same sort of legal restrictions imposed upon it. Federal service, when the Guard is federalized, as it is said, when it comes under federal control, the president can call a Guard into federal service in emergencies. Once federalized, the Posse Comitatus Act applies, so they cannot act as civilian police. Again, disentangling the legal ramifications of this can be complicated. So when the National Guard acts under the control of the state, it can essentially act as a kind of police force. When the National Guard is under the control of the federal government, it cannot, at least in theory. They can provide logistical support, security, or transport, but not perform arrests or policing. Once again, under the very sort of ominous-sounding Insurrection Act is invoked. Federal law enforcement agencies. So this is where things get a little more complicated. ICE, the FBI, the DEA, ATF, U.S. Marshals, Border Patrol, DHS officers are always authorized to enforce federal law anywhere in the United States, including states and cities where officials oppose their actions. They can only enforce federal law, not state or local law, unless there's a cooperative agreement. They do not need state or local approval to operate within a state or city. Local officials can object politically or refuse to cooperate, but they cannot legally prevent federal officers from operating. Obviously, this would then pertain to the ability of ICE to function in these cities. Legally, the states cannot stop them, or local governments cannot stop them from enforcing federal law, which immigration law is enforced by federal law. So legally, ICE does have, a legal mandate to do what it is doing. ICE can arrest people in cities, states, even if the governor or mayor opposes it, because immigration enforcement is under federal jurisdiction. Local police can refuse to participate, as in sanctuary cities, which may limit intelligence or logistical cooperation, but they cannot stop ICE agents from enforcing federal immigration law. I should point out also, by the way, that violating immigration law is a civil offense, not a crime. I was talking to some people about this. Some people apparently are confused about that. But being an undocumented immigrant is not a crime. It's considered to be a civil offense. By the way, so claiming that all illegals are criminals, which I've literally heard some people say, is not in fact true. Legal challenges to ICE are possible, of course, if ICE violates other laws or constitutional rights, like, say, murdering somebody in broad daylight. But mere opposition from local officials does not stop ICE operations. This distinction explains why federal agencies like ICE can operate in cities despite state lawsuits and mayoral objections. The federal government has exclusive authority over immigration enforcement, unlike domestic policing. Now, again, I want to just pause for a second, because I know there's a lot of negative animus towards ICE and Trump's policies under ICE. But I think people should be aware of the fact that under Democratic administrations, while certainly the second Trump administration has been far more aggressive, it is not as if the Democrats are sort of soft on this issue, as they're often portrayed to be. This title here, who is the Deporter in Chief? It's a rhetorical question. I mean, that was a title earned by Obama, by immigrant rights activists. And if you can see the numbers here, I'm sorry if it's a little, maybe too much to read. I tried to keep it as simple as I could. Obama deported, which includes removals and returns. Again, there's legal terminology to understand here, was significantly high. And I'm sorry, I neglected to include it. I thought I had the breakdown here. But even if you isolated Obama's first term, Obama deported more people in his first term than Trump did in his first term. Something to keep in mind. Biden, if you include regular deportations, as well as the use of something known as Title 42, which used the pretext of the pandemic to block or to remove people from the country, also removed over 4 million people, which was also significantly higher than Trump's second term. First term as well. What will happen under Trump's second term is, hard to say. This stuff was highly visible during Trump's first term as well. I do feel to a large extent this is kind of like a spectacle in many ways, meant to convince people who are in support of this that Trump is doing all of this stuff. But there is evidence to suggest that the Democrats do it just as well. They just kind of do it more like secretively. They just do it sort of more in the shadows, whereas Trump is deliberately trying to call attention to himself. And there are other reasons for thinking that as well. ICE funding surged. In fiscal year 2024, Congress provided about $3.4 billion specifically for the ICE detention system, funding an average daily population of about 41,500 detainees, a level higher than ICE saw during the Trump years. In fiscal year 2025, which, by the way, runs from October 1st, 2024, so before Trump was elected and was sworn into office, budget requested funding for 34,000 beds, up from earlier proposals around 25,000 prior cycles, showing a shift toward expanded detention capacity. So, people were talking about abolish ICE during Trump's first term. And then, we act as if there wasn't like a presidential administration between Trump's first term and his second term. Why didn't they do that? They didn't. NGOs and other watchdogs note that congressional appropriations have reversed earlier proposed reductions, pushing higher bed levels and fundings than what some advocates in earlier administration uh, proposals sought. So there seems to be maybe some evidence that early on in the Biden administration, there was attempts to sort of not abolish these things, but maybe scale things down a little bit, but then they sort of changed course and actually sort of, increased funding and detentions. Again, it's pretty much what I just said here. So let me just move on. Of course, there is, strong evidence that conditions in ICE detention facilities have serious problems. According to Human Rights Watch, they report inhumane conditions, medical neglect, sanitation issues, and oversight failures, disproportionate harms that affect Black detainees and LGBTQ detainees facing harassment and abuse, the use of solitary confinement, which according to the UN can meet the definition of torture under certain circumstances, of course, are a chronic issue as well. Although they do show that this is getting worse since 2025. Let's finally get to the Insurrection Act. So this actually predates the Posse Comitatus Act by 70 years, passed in 1807. It allows the president to deploy federal troops domestically in cases of rebellion or insurrection, or when state authorities cannot or will not enforce federal law. However, it's seldom been used in American history. Really, the most significant times that it's been used were during the Civil War, obviously used to suppress Confederate rebellion, and then during the Reconstruction period. And then, this is important to point out, it was also used during the Pullman strike or the Great Railroad Strike of 1894, where President Cleveland, Grover Cleveland, sent federal troops under the act to break the strike in Chicago and other cities, citing failure of local authorities to maintain order. Aside from those uses, I'm not aware really of any uses of the law. So it's very seldomly used. And so the fact that Trump is constantly threatening to invoke this law should communicate to people how significant, how much of a serious act that this is. And it's certainly not for the absence of other, conflicts that have obviously going on in the society since then. Yeah, I already kind of covered this when the federal government can control the National Guard. Protest of ICE raids, which is what Trump is referencing here, does not constitute an insurrection, though. Trump is trying to conflate people protesting the presence of ICE in their cities as a full-on insurrection or basically a rebellion against the United States government, which is just an absurd argument. ICE raids are, again, considered to be routine law enforcement actions, so they're regularly carried out by this agency. Even if local officials refuse to cooperate, as many of them do, this does not constitute an insurrection or rebellion under the law. And of course, this would apply to people protesting. They're not engaged in a full-scale rebellion against the United States government. They are protesting the presence of a specific agency in their cities, carrying out, policies which they do not agree with. And people, throughout history have engaged in protest and even civil disobedience against what they consider to be the unjust use of authority. Now, I'd like to run through some other episodes really quickly where National Guard troops have been called in, sometimes under federal authority, sometimes under state authority. But key point here is that none of these things actually involve the invoking of the Insurrection Act. So in Little Rock, Arkansas, so many of these episodes, of course, date from the civil rights movement of the 1950s and 60s. Probably most famously in Little Rock, Arkansas in 1957, President Eisenhower federalized the National Guard, did not use the Insurrection Act. He did send the 101st Airborne Division to enforce the court-ordered desegregation. However, they did not perform policing functions. They were not, arresting people or anything like that. In the University of Mississippi in 1962, President Kennedy sent federal marshals and later troops Again, National Guard to enforce a federal court order. Same thing happened in Alabama in 1963. Again, but no usage of the Insurrection Act. You had various riots and urban unrest during the 1960s as well. Watts in 1965. Again, California National Guard deployed, but not under federal control. In Detroit, 1967, the National Guard was federalized, and Army and Marines were called in as well, but again, without invoking the Insurrection Act. In Los Angeles in 1992, the Rodney King riots, the California National Guard remained under the control of the California government. Some federal troops were on standby, but were not actually deployed. In Ferguson, Missouri in 2014, after the shooting of Michael Brown, Missouri National Guard was deployed, but again, under the control of the state. George Floyd protests nationwide throughout 2020. National Guard deployed in many states at governor requests. Federal law enforcement were sent in to some cities to protect federal property. Active duty military were staged near DC, but not deployed on the streets. So the use of the National Guard was widespread. I believe in pretty much every circumstance, still under the control of the state government, though, as well. But there was, of course, the strong presence of federal law enforcement as well. Again, the lines between these things can get fairly murky, though. Where do you draw the line between law enforcement and National Guard or military? I mean, again, there are differences, of course, but from the perspective of many people, it might be incredibly hard to see the difference between these things. During the July 1977 New York City blackout, New York National Guard was deployed. Again, under the control of the governor, though. In 1979, New York State prison guard strike. Again, under the control of the state government, but was deployed. In 2024, Governor Hochul announced the deployment of 750 National Guard troops to patrol subway stations. Many people were critical of this. And then also in 2024, about 2,000 National Guard members were deployed to assist with logistical and operational support in migrant shelters across New York City. Then you have labor issues. The Great Railroad Strike. In 1877, federal troops deployed under President Rutherford B. Hayes to crush a nationwide railroad strike sparked by wage cuts. Over 100 workers killed. Workers in St. Louis briefly took control of the city, led by the Working Men's Party. So again, federal troops were called in and placed under federal control, but this does not require the invoking of the Insurrection Act. You also have the Homestead Strike in 1892. Very, very violent labor struggles. I cite that in the article I wrote. That according to a presidential commission on violence, which was convened in the late 1960s, the U.S. had the most violent labor struggles of basically any industrialized country up until that point. The Pullman strike in 1894, which I mentioned, did in fact invoke the Insurrection Act. So you see a very strong reaction, against labor issues during this period of time as well. Coal miner strike, the bonus army. Okay, I sense maybe I'm kind of, beating this point home a little too much. And actually, that's perfect time, because now I want to sort of move on to talking about something else. So again, very complicated relation between federal and state authority here regarding the deployment of, the use basically of coercive force and how that is basically governed, and what sort of agencies and what sort of institutions, sort of fall underneath that. Hopefully I've tried to clear that up a little bit, although again, it is obviously a very, complicated thing to understand. Now I want to switch to talking about healthcare. Now we'll start to talk about some of the disparities that we see between states in terms of healthcare outcomes and education outcomes. So in 2012, the Supreme Court ruled that coercing states to expand Medicaid was unconstitutional. So one of the major aspects of the Affordable Care Act was that it was going to expand Medicaid, who would be covered. However, not all states signed on for that. Some states refused to sort of expand Medicaid coverage. Medicaid, if you don't know, is basically a program that is sort of duly administered by federal and state government. Basically, the federal government allocates a large sum of money, and then it basically distributes it to the states and sort of gives them significant, leeway as to how that money will be spent. So some states simply said, no, we don't want to expand Medicaid in our state. We don't want to cover more people, basically. As a result, some states have opted out of expanding Medicaid: Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. Now, while the idea of Medicaid expansion sounds maybe good in theory to many people, keep in mind that, in reality, of course, it's still very limited, right? Even at its expanded level, it covers people at 138% of the federal poverty level. It's still a very low amount. For an individual person, that's only about $20,000 per year, or for a family of three, that's about $34,000. So that means if you're making over that amount, which is very, very low, you would basically not be covered by it. Now let me switch over here to my web browser. So these are readings I included for this class. Here you get a better sense of healthcare outcomes in the United States. And as you can see, this is from an organization known as the Commonwealth Fund. And one of the things that they do is they literally give a scorecard on states in terms of their healthcare rankings. And so you can see, the rankings of the states here. Massachusetts is number 1. Mississippi is last, 51, because they include the District of Columbia as well. And you can basically see, I'll leave it up to people to read this on their own in detail and see how they determine it. But basically, it covers things like access to healthcare, as well as, healthcare outcomes too, like premature deaths. So the Affordable Care Act coverage expansions have reduced the uninsured rate in every state and narrowed differences. Of course, these things have expired, and it's not clear whether or not they will be able to expand these things, which I'll talk about in a moment. Of course, many people still do not have health insurance in the United States. I would also add to that many people who do have health insurance, still are, have a hard time covering costs and still find, healthcare costs, insurance premiums, things like that to be, a significant burden upon them. So this report from 2025, basically in many ways gives a lot of credit to the Affordable Care Act extensions, which were signed in 2021. Again, it's an important thing to keep in mind. These things were not part of the original sort of, version 1.0 of the Affordable Care Act, which is very, very lacking in many ways. But once again, under the pretext, or in the context of the pandemic, and as part of the American Rescue Plan, we're basically able to sort of extend coverage, or extend tax credits basically to people to sort of ease the financial burdens. Talk about declining childhood vaccination rates in many states. As you can see here, fewer children are being vaccinated now. And again, this basically falls within the rankings of states that you would have seen above. Infant mortality rate has fallen in some states, but risen in others. That's basically, children who die within the first year of their life. A very chilling statistic to consider, but something, of course, which you do have to think about. Rates of premature deaths from preventable and treatable causes are highly variable across the states. And again, the states where you see the highest level of premature deaths are basically within these southern states for the most part, as well as some of the Midwestern states as well. America is not a particularly, healthy group of people, all in all. And there are various reasons for that. Many people would say the lack of access to healthcare obviously being one, poor diets, the work-life balance that many people are forced to maintain, all contribute to these things to a large extent. Rates of premature deaths for Black people are higher, significantly higher compared to most other groups, as you can see here. Elevated for Black residents in every state. So this is the rate of premature deaths, and this would be the lowest mortality rate in the state as a whole. So significantly higher, as you can see, in most states. While the number of annual deaths from drug overdose fell nationally between 2022 and 2023, the number of deaths remained elevated over pre-2020 levels. So significantly high, of course. And then basically, they end with, fairly standard, calls for greater healthcare access and affordability. Okay. Another thing that they focus on is of course, the abortion bans, which have been enacted in many states as well. And again, here you see, if you go back to the list of states with the highest premature death rates, you'll see there's significant overlap between the two. In fact, maybe I should just do that right now. So take a good mental image as I switch over here. I mean, they're almost the same, right? As you can see. These states also have basically the highest maternal mortality rates as well. So it's an important thing to keep in mind. The states where it's basically hardest to get an abortion in, or if not completely illegal, are also the states where women are more likely to die during the course of childbirth than in almost any other state. And they don't seem to be doing anything about that. I mean, as far as like lowering that maternal mortality rate, which once again is significant. We'll look at this more when we talk about Roe versus Wade and the Supreme Court later on in the semester. But the maternal mortality rate for Black women, again, significantly higher than for most other social groups in the United States. Only American Indians basically come closest to that. And why is that the case? I mean, obviously these things have economic factors, have historical factors, institutional factors. Again, lack of access to healthcare, aspects related to work life and residential life, where people are living, what they're exposed to. I mean, all these things play a significant role in that. And again, so these are states that have basically completely banned abortion, and you can see the various, categories here. Between 6 and 12 weeks is very early. Most people would agree that the viability of a fetus is somewhere around 20 weeks, I believe, or even 24 weeks. The whole question of viability is an interesting debate as well. They're essentially saying when could a fetus live outside of a womb and survive. It's essentially like saying, like, when does personhood begin? And you see, the 20-week or 24-week standard is kind of like a compromise, right? Some people say that life begins at conception, right? As soon as an egg is fertilized, you are a person. Other people would say, well, you don't become a person until you're born, right? I mean, before you're born, you're not really a person. So the 20-week thing is sort of a compromise between this, but like most compromises, probably doesn't really satisfy anyone. Anyway, let me go back to my PowerPoint. So again, I mean, the key takeaway here, and of course we could go more in depth talking about all these issues and healthcare in the United States, but sort of the key takeaway here is the tremendous disparity that exists between states. Healthcare outcomes in the United States are wildly divergent, I think in many ways that deals with the political and legal institutions which sort of govern the provision of healthcare within these states. Let's talk a little bit about the ACA tax credits, officially called premium tax credits. They help eligible individuals and families lower the cost of monthly health insurance premiums purchased through the ACA marketplaces. The amount of credit depends on household income relative to the federal poverty level. Cost of the benchmark plan in the marketplace, the second lowest cost silver plan. So there's like gold and silver and bronze plans. Temporary enhancements. During the COVID-19 pandemic under the American Rescue Plan, subsidies were increased for low and middle income families. So again, this was not included in the original version, or it was much more sort of scaled down in the original version of the Affordable Care Act. Caps on premium payments as a share of income were lowered. Higher income households became eligible for subsidies they normally wouldn't qualify for. So it's basically, a credit or a payment that would, go towards your health insurance premium to reduce more of the cost for yourself or for your family. The enhancements were originally set to expire at the end of 2022. Most of the, provisions of the American Rescue Plan Act basically expired after a year. This is when people were telling us that Biden was the next FDR, which is kind of absurd to be like if like the New Deal basically expired after like its first year. But these were one of the things that they were able to keep going for a period of time. Congress extended them through 2025 via the Inflation Reduction Act. But officially, as of now, as of January 1st, they have expired. And so what's going to happen is that people are going to see their premium costs, double or triple in cost. And again, keep in mind that was the way the system was originally, set up, even under the first version of the under the Affordable Care Act, which was then sort of, refined a little bit in 2021. Now this is on top of so part of Trump's budget, of course, has been to refuse to expand these ACA tax credits. This is on top of $800 billion in reductions to Medicaid as well. Massive cut, basically to pay for the tax cuts for wealthy people. Now, many people, of course, who support these things say that, well, they're trying to eliminate fraud and wasteful spending. And there's recently been controversy over this in the state of Minnesota as well, supposedly as a result of some expose. However, apparently what I've read is that these supposed expose of welfare in Minnesota is largely a fraud and just something sort of manufactured to serve as a pretext for even further welfare cuts, which Trump, of course, has since done. Actual evidence of fraud, whether it's in Medicaid or other aspects of social welfare in the United States, multiple reports from the Government Accountability Office, the Congressional Budget Office, and others, of course, do acknowledge that fraud exists, but they estimate it to be basically about 1 to 2% of overall spending. While most improper payments are due to documentation or procedural error. So actual fraud, they say, is quite rare. However, of course, you could imagine if some people seize upon some sort of administrative error, somebody has the wrong address, or somebody's moved and didn't update their address, or something like that, or somebody died and the agency wasn't informed of it, and a check is still sent out for them. People, of course, quickly seize upon these things to act as if it's fraud. But true fraud, they say, is generally very, very low, at least according to their estimates. Another important thing to point out is that fraud, they say, is overwhelmingly committed by the providers of healthcare, the doctors, clinics, labs, and pharmacies, who basically send their bills to the government, not by the beneficiaries, not by the people who are recipients of Medicaid or tax credits. Beneficiary fraud is negligible, they say, accounting for only a tiny fraction of convictions and recoveries. Claims that illegal aliens are getting ACA subsidies are political rhetoric, not supported by data. If you want to read more about it, I've included several links to different reports. So let's talk about Rick Scott, an interesting guy. Republican politician, former CEO of Columbia HCA, once the largest for-profit hospital chain in the United States, later became governor of Florida and is currently a United States senator. In the 1980s, Columbia HCA engaged in massive Medicare and Medicaid fraud. Practices included overbilling for services and tests, falsifying diagnoses, kickbacks to doctors for referrals. The company paid $1.7 billion in fines and settlements, the largest healthcare fraud settlement in history. But of course, there were no criminal prosecutions, even though fraud is a crime. It is a felony. Much more of a serious crime, by the way, than violating immigration law, which is again a civil offense, not a crime. Rick Scott resigned as CEO in 1977, was never personally charged. This is very similar to what the Obama administration did during the the aftermath of the financial crash in 2008. There were settlements made with some of the banks involved, but again, no criminal prosecutions, even though it's quite clear that these banks were engaging in fraud as well. Anyway, so most of the fraud, and again, this is something that gets completely erased in the conservative discourse on this topic, but most of the so-called fraud that happens in Medicare and Medicaid is actually coming from the people who are basically billing the government, not the people who are receiving the government services. Often framed as taxpayer-funded healthcare for illegal immigrants. There's some truth to that, but it, of course, is very misleading. So programs that cover undocumented immigrants in the United States only pertain to a very small portion of the undocumented population. They're very limited in scope, mostly for children, pregnancy, or primary care, not full health coverage. Federal subsidies like Medicaid and ACA credits do not go to undocumented immigrants. So most of the programs are basically state-run as well. And so, here's the question here. Do you not want the children of undocumented immigrants to receive healthcare? Do you not want pregnant women to receive healthcare just because they are undocumented? Do you not want somebody who's having like a heart attack to get healthcare, who requires, immediate emergency care just because they are an undocumented person? You want them to just die on the street, basically? Well, unfortunately, the sad truth is that a lot of people probably, well, not a lot, but some people would say yes to that, right? They simply just do not care. But I don't think most people would. Most people obviously would see that, yes, if you can save somebody's life or provide, healthcare to children or to pregnant women, then you probably should. So some more details over this. Let me try to move things along a little bit. Emergency Medicaid is available to everyone regardless of immigration status, but it is strictly limited. Again, covers only emergency medical conditions, including child labor and delivery. Does not cover ongoing care, chronic conditions, or preventative services. Emergency Medicaid is federally funded and reimburses hospitals for urgent care. Some states do use state funds to provide broader coverage to undocumented immigrants, like in California, New York, Illinois, and Washington. But here again, very limited as well, mostly, again, pertaining to the same thing: pregnancy care, children's care, emergency care, and in some cases, preventative services. But again, very, very limited in scope. And not every state offers these things. Many states are scaling back. So, for example, California's Medi-Cal system provides this now, but they're scaling this back, as are, I believe, many other states as well. Now, another thing to talk about, since we're so concerned about fraud and wasteful spending in the government, why don't we talk about the military? Why don't we talk about the Department of Defense? Or I'm sorry, it's now the Department of War, isn't it? And the ability of the Pentagon to be audited, to have its finances looked at and investigated. So from the 1990s onward, after the Cold War, Congress required the DoD, also known as the Pentagon, it's probably easier to call it, right? The Pentagon building is the headquarters of the Department of Defense or Department of War, or whatever you want to call it. For decades, the DoD refused or failed to pass a full audit, citing the sheer size, complexity, and outdated accounting systems. In early 2018, the DoD submitted its first full financial statements for audit. DoD received a disclaimer of opinion, meaning auditors could not verify the accuracy of most financial statements. Trillions of dollars in unsupported transactions could not be accounted for. Fragmented financial systems across branches and contractors, poor tracking of equipment inventories and obligations. So basically, the Pentagon cannot go through a full audit. There's no way that people can actually verify that the money, the trillions of dollars circulating throughout the Pentagon, is actually going where people think it's going, or have in some cases no idea where it's going. And I think, frankly, not to get down this rabbit hole, but a lot of this does deal with the incredible secrecy in which the United States military operates, the shadowy activities, to say the least, that the U.S. has been a participant in, even including things like drug trafficking and things like that, as well as including intelligence agencies in the United States as well, but also within the military. Fiscal year 2023, the report discussed the DoD's progress towards achieving a clean audit. Once again, the GAO, Government Accountability Office, gave a disclaimer of opinion, meaning auditors could not confirm if the financial statements were accurate. So there's no way to verify the budget of the DoD, of the Pentagon. Yet people who are so upset about, Medicaid fraud and things like that never seem to point to this, don't seem to be particularly, concerned about things like this. Anyway, I could go on, but as you can see, this is a consistent problem that they have not been able to solve. Now, moving on to education. Education is another key issue, right? Public schools in the United States rely on federal, state, and local funding for schools. However, most of that funding comes at the state and local level. And that money is basically raised, that revenue is raised through property taxes, taxes that you pay, for the ownership of your home, which is, assessed based on basically on the value of your home. What that means, of course, is that people that live in areas with higher property values are able to generate greater tax revenues and fund their schools more. Areas that do not, that live in areas with lower property values, have less funding for schools. Now, as you might imagine, this creates serious socioeconomic inequalities within states, but even within localities within states as well, of course. One solution to that would be to have the federal government sort of, equalize spending for schools throughout the country. And there were attempts to do this in the 1970s. However, it was struck down by the Supreme Court, which claimed that education was an important, quote, important service, but not a fundamental right. Really, education is not a fundamental right. You do not need to have an education to live, basically, according to the Supreme Court. I'm talking about, a basic, primary school education. Of course, you have de facto segregation in schools is still a significant issue. Formal legal segregation no longer exists, obviously, after the Civil Rights Movement, but residential segregation still a very significant issue. More than and since your residency basically determines where you go to school for the most part, you see this segregation in schools as well. More than a third of students attended a predominantly same race ethnicity school during the 2020-2021 school year, according to, again, another report by the GAO. About 80% of students attending low-income schools are Black or Hispanic as well. Let me turn a little bit now to education spending. This was another link I provided here. So basically, K-12 schools spent $850 billion last year. Sounds like a lot. And people, once again, conservatives often cite this, and cite the relatively poor performance of U.S. schools as a whole, or the low test scores and things like that. And they'll say, well, you can't just throw money at a problem, and usually use this, of course, as a rationalization for cutting funding for education. You can't throw money at the problem. Look at all this money we spend on education in this country, and what do we really get out of it? However, this number here, 850 billion, has to be broken down, right? As we've said, this funding is not equally split between schools within the United States. I think most people can kind of see where I'm going here with this. Some areas are relatively well funded, some areas are relatively underfunded. And wouldn't you know, the areas that are relatively well funded actually perform relatively better than the areas that are underfunded. Amazing, isn't it? So it turns out that actually, as they call it, throwing money at the problem does work after all. If you throw money at schools and they actually are funded schools, those schools usually turn out better students than the schools that are underfunded. And all that is required to do so is to simply take this number and break it up or disaggregate it, as people call it, and actually see, the disparities in spending that goes on here. Now, I can't do a complete breakdown of it, but what you can see here is the breakdown of spending per student, per state. Now, the spending per student metric has its problems as well. Obviously, it assumes that the money is actually being spent on the student, which of course is not true. There is a lot of, overhead and waste, and there is a lot of, administrative bloat within schools. Too many administrators, not enough teachers, that kind of thing. But anyway, this is the standard metric that they use. Every metric has some flaws in it, of course. And using that as a way to determine, spending per students by state, you can see that some states spend more on education than other states. Now look at New York, which I believe spends the most, and Florida, which spends the least. These are states about equal in population to each other. I think Florida may even have a slightly larger population than New York State at this point. Florida spends significantly less on education than New York does. And once again, you can see, not to pick on the South, but I'll try to address that towards the end of this class. But once again, you can see, just like the southern states have the poorest health care outcomes, southern states also spend least on education as well, and also, of course, have the poorest, education outcomes as well. Now, what would be interesting, and maybe I will do this in a future class, I'm sorry I haven't done it now, is sort of break down spending in New York State a little bit more. And again, how much do you want to bet that certain areas and, Long Island and other more, affluent parts of the city, of New York State, I mean, in certain parts of Manhattan, probably have much higher spending than, say, the South Bronx or something like that. And I'm sure those areas have, because they are such economically distressed areas, probably do receive extra funding to make up for the serious disparities that exist. But I still bet overall you'll see that the better performing school districts probably are better funded, certainly from local property taxes and things like that. And of course, those things matter. Now, of course, you could go through this more and more and break it down more in terms of the numbers and data here. I'll leave that mostly to people themselves. I think one thing I want to focus on is the breakdown between federal, state, and local spending. So of the 850 billion spent, look how much states and local governments spend out of 850 billion. 383 billion from states and 375 billion from local government. So most of that spending comes from the state and local level. Federal spending on education is relatively limited. In fact, extremely limited for the most part. I think that's the most important thing I want to point out here. You can then make, international comparisons as well. Schools in the United States, using a somewhat different metric, spend an average of 20,000 per pupil, which is the third highest per pupil among 40 other developed nations in the Organization for Economic Cooperation and Development. You could say, oh, well, third's not so bad, but we are the richest country in the world. Why aren't we number one? It also says here the nation puts 12.7% of public funding towards education, well below the international standard of 15%. Here it says in terms of its gross domestic product, the United States ranks fifth among OECD members in spending. Top five, I guess you could say, but still, I would say that's fairly unimpressive for the most part. Again, of course, you always have to go back to the fact the United States is by far the wealthiest country in the world. Though, again, I think the real problem is not just sort of the gross level of spending, but how that spending is distributed throughout different parts of the country. I think that's really once again the main sort of takeaway from this point. All right. Now I want to talk a little bit also about the curriculum in the United States as well, particularly this tendency to teach to the test, which has become, a fundamental part of American education, but only has a very recent history. Maybe part of the reason I'm interested in this topic is that, quite frankly, when I went to school, I mean, this was not a thing. You did not take a standardized test every year, according to this, from grade 3 through 8, and then once in high school. This is a legacy of the No Child Left Behind Act passed by George W. Bush, and then sort of refined a little bit by the Every Student Succeeds Act in 2015. So there was a lot of talk about the No Child Left Behind Act when it was passed, and probably more people would have heard of that. Technically, the law has been replaced by this other law, the Every Student Succeeds Act, passed under the Obama administration. However, I would argue that the current law basically keeps in place the worst part of the No Child Left Behind Act, which is to mandate this testing every year. So the original version of law, placed a high emphasis on accountability. Schools were forced to administer these tests. Now, when I say forced, I should be clear. What that means is that if you receive any kind of federal funding, you have to do this, or the federal government will pull its funding. Now, even though the federal government contributes relatively little, states, of course, are very strapped budgets already. So, losing any of their funding obviously is something that they do not want to do. So most schools, to continue receiving federal funding, are required to do this. And again, the original version of the law had very strict accountability measures for schools. If they were not seen as making progress in raising these test scores, they could basically have their funding pulled. The current law, like I said, kind of relaxes those requirements a little bit, but keeps what I think is the worst part of this law, which is to just mandate these tests every year. And the results are very, mediocre at best. Despite all this emphasis on testing, is not significantly raised test scores at all, math and reading scores. There were some modest improvements in math scores, especially in the early years. Reading scores showed little to no significant improvement nationally. The biggest gains came from younger students, grades 4 through 8, not high schoolers. The law aimed to purportedly close racial and socioeconomic gaps. Some narrowing occurred in math, for example, between Black, Latino, and white students, but progress stalled after a few years. Gaps in reading largely persisted. Of course, no state came close to the proficiency goal set by the Bush administration. And so, like I said, under the Obama administration, kind of relaxed these standards a little bit, but basically have kept in place this testing regime. And here again, you see a sampling of math and reading scores, not very impressive. Reading scores barely improved at all. I see both scores fell significantly during COVID, which I suppose is one of the arguments that people make for the policies regarding COVID during this period of time. Or probably that could have been mitigated to some extent with sufficient funding and organization, which of course was not there. But again, you see some improvement in math scores, not significantly, and it's been basically stagnating since then. Even I mean, if you look at it closely, even prior to COVID, math scores were already starting to go down anyway. In international comparisons, the U.S. is below average compared to students in other countries as well. Um, Now, again, I think too much is made of these test scores anyway. But I think one of the and as we can see, despite the focus given to them, hasn't really been successful. So if the goal was to raise these test scores, then clearly the policy has been basically a failure, or at the very least you could say media, or at the best you could say mediocre at best. But beyond that, I think the emphasis on testing really has a severely negative impact on students. And I've spoken to many other educators. There's basically a consensus, I think, among educators that this idea of teaching to the test, basically crowding out every other subject just to focus on testing. And you have to keep in mind the tests themselves may be administered once annually, but there's almost constant drilling and practicing for the test before that happens. So what happens basically is that other subjects that do not fall under the rubric of math and reading are basically crowded out. That's the arts. I'm using that term, in the broadest sense. Music, painting, literature, even history, philosophy. Anything that does not fall under math and reading, and just like basic, vocabulary and things like that, and basic language skills, basically gets crowded out in favor of this teaching to the test. And yeah, kind of saying that here too. Yeah, less flexibility for teachers as well. There's more of a kind of bureaucratic centralization of education as well. This is in fact one way in which the federal government is increasing its power over education in this country, taking more power away from local school districts, of course. Now I tried to figure out when exactly the full effects of this would have been felt. So basically, students who would have been in third grade in the 2005 to 2006 school year would have been the first sort of cohort of students to go through the whole regimen of testing every year. And these people would have basically entered college as freshmen around fall 2025. Now, I've been teaching college since 2009. And I got to say, I can't quantify it exactly, but based on my own experiences and based on talking to many other people, you can see a noticeable difference in students, and not for the better. I'm sorry to say. Of course, there are individual exceptions, and it's not going to affect everybody. But broadly speaking, I mean, I've had thousands of students over the years. You do see a decline in just students, general knowledge of things, much more unaware of history, even relatively recent history. And yeah, I mean, frankly, it makes teaching harder. There's just less basic knowledge that the students have, which you would expect them to have, particularly as they enter college. So I don't want to get too much into this and go into my own personal examples here, but yeah, I mean, broadly speaking, I kind of hate to use this language, only because I can't like prove it, but I do think that it is kind of leading to sort of like a dumbing down of students. Broadly speaking, I'm not saying that about everybody, of course, but overall, it is something that you can kind of notice for the most part. And of course, particularly at the college level, college is becoming more and more expensive as well. Um, Many colleges used to be free. Many public colleges used to be free. Um, but pretty much all of them have now introduced tuition costs, and these tuition costs, continue to get higher and higher. All right, so now with all that being said, so we've talked about the use of federal and state authority governing National Guard deployments and other sort of coercive force, law enforcement, even active duty military, the legal ramifications of that. We've talked about healthcare outcomes. We've talked about education outcomes. So one of the things that again should sort of stick with people coming out of this class is that southern states, generally speaking, and you can even sort of extend this into the Midwest as well, though less, it's more dispersed there a little bit, but certainly within the classical northern south distinction in the United States, you certainly see significantly lower outcomes in the South relative to the North. Now, why is that? Now, I would like to briefly, and you may also wonder, well, why did I sign readings by Daniel Webster and John C. Calhoun? And what does that have anything to do with anything that I've talked about in this class so far? Look, I have that much of a chance because I have been talking for quite some time now, but I would like to link up basically what has gone on in the past with what is going on in the present. And so to do that, I would use the political scientist Berthold Oman's idea of what he calls the dance of the dialectic. What he's saying basically is what is known as a dialectical approach, which is a tough concept to define. The way in which he's using is basically sort of like a method of inquiry. When you're looking at a dialectical approach, it's a specific guideline by how you sort of analyze a society and try to look for connections between things, particularly the sort of contradictory relationships between things, and try to put it in a kind of historical context, essentially. It is a method which is closely associated with Marx as well. So this is a excerpt from one of his books. And you see, he literally, depicts it as dance steps. So you sort of look for connections between things in the present. You then try to put them in their historical context. As it says here, I'll read this little side text here. Look for connections in the capitalist present. Look for the preconditions of the most important of these connections in the past. Project major social contradictions forward from the past through the present to their resolution and beyond in the future. Look for preconditions of such a future in the present and use them to develop your political strategy. So it's this complicated relationship between the past, present, and future, and understanding the connections between those things. So that's really where people like Webster and Calhoun come into play. I would argue that a lot of the negative outcomes that you see in the South can be located in the past, but I want to be careful to say, well, it's not just because of things that happened in the past that they are the way they are now. What has happened in the past has continued to reinforce itself in the present. So this is again, a little bit of a reiteration of present, past, future, return to the present. Really quick, let's try to relate this to what I've been talking about in this class. So we're looking at the present day. There are contradictions within the South: lower healthcare outcomes, lower educational outcomes, as well as persistent conservative politics at state and local levels. Now, I should also point out that when Ullman is adapting this approach, he's really talking about capitalism as a whole. He's looking at the contradictions within capitalism as a whole. I'm applying this more narrowly to this, which I think is something that you can do. There's sort of like a hierarchy of different wholes and parts and wholes that you can look at. So I'm looking at this not as an overall view of capitalism, but one specific aspect of it. These outcomes are not isolated facts. They are internally related to political ideology, policy structures, economic systems. Contradictions emerge between public needs, healthcare, education, welfare, and political and ideological commitment, limited government, states' rights, anti-redistribution policies. The present is a structured system of interacting processes, not a collection of independent problems. The historical conditions for this: the origins of Southern conservatism. John C. Calhoun, very important political figure in the South's past. His doctrines of states' rights, minority veto, protecting elite interests, defense of slavery and segregation. He himself did not defend it, but of course, like-minded people did. Um, you also have historical and social structures, racialized labor systems, elite landholding classes, resistance to federal intervention. So these things which coalesced in the past continue to play out in the very present day. Institutional legacy, state constitutions emphasizing local control, political structures that limit redistribution, particularly, of course, to African Americans in the South. Pattern of public funding, reflecting conservative priorities as well, low levels of funding, in other words. The present conservatism is not a relic, is a continuing expression of these past structures, which evolved rather than disappeared. Now, the future, where do basically things go from here? What are the potential unfolding tendencies that we can see? Projection from the present. The potential for improvement exists where federal intervention can override local state constraints. Social movements and political organizing can challenge entrenched conservatism, like the so-called Red State revolt of teachers in 2018, for example. Economic or demographic changes may shift political balance. The so-called dialectical insight, future possibilities are contained in the present. So you have to be able to look at the present and see where the possibilities for change are. Existing problems, Medicaid expansions in some states, public education reforms are seeds for broader change. Social awareness and activism represent latent forces. Now, again, here you have to go, if you really want to apply this approach, consistently, we have to go beyond just the expansion of Medicaid and really, confront contradictions within capitalism itself, which I've already tried to talk about in a previous class. Conversely, conservative structures can persist and adapt, reproducing the inequality. The future is not deterministic, meaning the future is not predetermined, but emerges from the interaction of existing contradictions. And then step 4, using the projected future to reinterpret the present. Seeing potential future clarifies which present structures are obstacles versus enablers of change. So how does the current structure block change versus where are the possibilities for change within the present structure? Where are the latent possibilities? Where's sort of like the hidden potential, essentially, for change within the current structure there? How ongoing political processes maintain or exacerbate contradictions? How citizens' agency and collective action could leverage latent potential in existing institutions as well. Understanding that Medicaid expansion is possible in some conservative states show the present as a site of struggle, not a fixed outcome. Again, you could talk about other things like, the Red State revolt and things like that. But, again, you would also have to, I think, be a little bit broader and more ambitious in your goal beyond just, expanding Medicaid and really, consider the overall contradictions within capitalism as well. And here you have the lovely face of John C. Calhoun. I guess I will wrap things up here. Again, I could talk more about it. Calhoun was an interesting figure to say the least. But I would argue that, yes, a lot of the policies that he supported, of course, other like-minded people have sort of set the South on a trajectory that continues to play out to this day. And I'm not just saying only because of what happened in the present, but it's because what was established in the present continues to play out and continues to reinforce itself in the very present day, some of which I've talked about, hostility towards, spending, the long history of racism, which also works against, social spending in the United States, because, God forbid, some of this money gets in the hands of Black people in the South. The policies that favor, smaller government, things like that. The ideology of small government and pro-capitalist ideology that you see play out there as well. There are various, things that interact, some of which I've tried to outline already. But all right, so I'm going to wrap things up here. So that's it. So take care, everyone.